Are you looking for more natural options in your healthcare? Have you been told that you have to learn to live with your health problem? If you answered yes to one or both of these questions, I encourage you to listen in on the next few minutes as I'm going to share with you a shift that is occurring in the world of medicine. Hi, I'm Dr. Mario Mancini, the Medical Director of the Center for Integrative Care. We're a functional medicine and peak performance center here in San Diego. Now, the world of medicine is coming full circle. We're moving away from an old, outdated disease-centered model called disease-centered care. And with that type of care, there came a certain question. And the question was this: what type of disease does this person have? See, when you ask that question, you start to focus on what? Disease. And when you focus only on disease, guess who gets left out? That's right, the person over there. Now, if you focus on disease only, you may knock out that disease, but guess who's going to go along with it? A lot of times, the patient. In other words, increased risk factors for the benefits desired. Now, there are times that you may need to consider this as in life-saving procedures or medication, or in cases of chemotherapy for cancer. Yes, it will blast out the cancer, but the patient gets beat up in the process. Or taking antibiotics to knock out that bug, but it's also going to wipe out your intestinal flora. Again, there are times that these modalities are necessary. But with that said, we now have more integrative options that can support the body during the use of these modalities or as another option entirely. These options are possible because there's a shift occurring in the healthcare system. We are now moving away from an old, outdated disease-centered model into a new era of medicine called patient-centered healthcare, which asks an entirely new question. And here's the question: who is the person who has the disease? Where's the focus now? That's right, you, the person. See, when you come from this question, your entire healthcare changes and you start to look upstream at those upstream issues. You start looking at diet, lifestyle, exercise, nutrition, mindset, and a standard of health. This is what integrative and functional medicine is all about. So what's happening now is that we're getting a merging of both systems where Western medicine and Chinese medicine are coming together in what we call functional medicine. That is what patient-centered healthcare is all about. And by the way, I often remind this to my patients at the center who are already referred by their doctors. Why? To remind them that they are part of this exciting shift that's all about them being in the front seat of their own health. I found this to be quite empowering for patients to know that they are at the center stage of their healthcare. The fact that over 85% of patients that come to our center are referred by medical doctors tells us that the focus of these doctors is on what's best for the patient's return to health. In today's world, we are seeing that patients can have access to both systems of medicine, which clearly has a synergistic effect leading to a reduced need or increased effectiveness of medication. Now, on that note, I'd like to share with you a really interesting study that I found eye-opening. This study showed that in 1997, Americans made 380 million visits to their medical doctor. That sounds like a lot, but wait a second. You know what was even more interesting? At the same time, Americans made 627 million visits to alternative medicine practitioners. That's almost twice as much. According to Harvard Medical School, 1 out of every 2 people in the United States between 35 and 49 years old has made a visit to an alternative medicine practitioner. See, with such a significant increase in the use of alternative therapies, it's obvious that there's a greater demand for non-pharmaceutical options. For example, medical doctors refer patients to our center to help these patients reduce their need for pain medication through the use of biomedical acupuncture. So this shift is happening everywhere. So a question you may want to ask yourself is, what can I do to be part of this shift? Well, the first thing is to have an understanding that the medical system is known as mainstream medicine, containing 2 sides to it. We have downstream and we have upstream. Downstream is what? The treatment primarily of symptoms, signs, and disease. And upstream is what? Focusing on improving lifestyle, exercise, diet, nutrition, standard of health, and the mindset behind it. See, there are thousands of diagnoses and thousands of diseases. They are just the downstream effect of a weak link, and that weak link is always, I repeat, always a breakdown in function. So again, how can you be part of this shift? Start thinking integrative, utilizing the best of all science-based medicine. Think beyond just your condition. Start looking upstream and ask yourself, and ask us, what else can I do? How else can I help myself? You want to start focusing on thriving, not just surviving. If you focus only on surviving, you're just going to meet your day. You're going to just get by. The empowered patient sees himself at the center stage of integrating the best of all medicines. One last thing, you want to be proactive, not reactive in your healthcare. When you're reactive in your healthcare, you live in fear. When you live in fear about your health, you stay stuck at the effects of your life. So decide to take responsibility and get back into the driver's seat of your own health. See, in our modern medical system, the combination of multiple therapies significantly increases patient outcomes. This integrative approach has a greater effect than any one modality. So adding science-based natural medical modalities such as acupuncture, dietary, herbal, and nutritional therapy, as well as brain training technology called neurofeedback into your healthcare is a safe and effective approach to the treatment of many health problems, especially pain, inflammation, stress, anxiety, and depression. So, if you'd like to find out more about how we can assist you with your specific health concerns and how we can best integrate the use of natural medical modalities along with your current healthcare in a safe and effective way, contact our office to schedule a free consultation with one of our functional medicine specialists where they can answer any questions you have to find out if and how we can help you with your healthcare needs. I'm Dr. Mario Mancini, and I wish you the best.